I'm Ishan Shah. I'm one of the general non-invasive cardiologists at Virginia Cardiovascular Specialists. I went to University of Virginia for undergraduate. I studied biology there. And then I went to Eastern Virginia Medical School. And then I did my internal medicine residency at University of Virginia again. So I was able to establish a good foundation in medicine there. After that, I went to Medical University of South Carolina in Charleston for my cardiology training. And with MUSC being the only academic center in South Carolina, I was able to get tremendous clinical exposure within cardiology there as well. And then after finishing up in Charleston, I wanted to move back to Richmond to be closer to family and friends. My focus as a general cardiologist is going to be on prevention of cardiovascular disease and then medical management of the various cardiovascular conditions as well, including coronary disease, heart failure, valvular disorders, and arrhythmias. Patients often have multiple cardiac conditions, and you really need to tease out what's the primary condition that's driving their symptoms. And as a general cardiologist, you need to be well versed in all of the different conditions. And then if medical management fails, at that point, you can refer them to the subspecialist within cardiology who focuses on that specific condition. I'm going to be focusing on advanced cardiovascular imaging in addition to the traditional methods like echocardiography and stress testing. I think the non-invasive field within cardiology has advanced quite a bit, and now we can arrive at the diagnosis non-invasively in most cases with cardiac CT and cardiac MRI. And I think these advanced imaging modalities, both cardiac CT and cardiac MRI, are very complementary for the advanced procedures that we do as well. They really help us, with the pre-procedural planning to make sure that the procedure is safest and leads to the best outcome for the patient as well. I chose Virginia Cardiovascular Specialists because it is a large, reputable, and well-established group in the greater Richmond area. I was really impressed when I came for my interview how collegial everyone was and how well everyone got along with each other. So if I have any questions related to any complex valve disease, arrhythmias, I know VCS has the experts that I can go to who specialize in that specifically. I think the patient-physician interaction is kind of the most rewarding part of the job. I really enjoy, supporting the patient and their family when they're acutely sick in the hospital, and then following them along in the outpatient setting to prevent future hospitalizations and improve their health. That's probably the most rewarding part of medicine for me.